Next thing we're going to talk about is coagulation. So the lack of intestinal bacteria needed to synthesize vitamin K results in transient blood coagulation deficiency between the second and fifth days of life. So what this means is at birth, the intestine lacks bacteria that's needed to synthesize vitamin K. So we give an iron injection of vitamin K after birth to help prevent bleeding problems. Signs of hepatic system problems. One thing to watch in male infants who has been circumcised to observe for hemorrhage, because this could be the first sign or recognition that the baby has hemophilia. Next, we're going to talk about the immune system and why babies are at risk for infection. So, in the immune system, most IgG is received from the mother and crosses the placenta. IgG is key to immunity to bacteria and viruses. The fetus produces IgM by the 8th week of gestation. IgM is important to the immunity of blood-borne infections. IgA is obtained from breast milk and decreases the risk of allergy and food intolerances. In the babies, signs and symptoms of infection include hypothermia, lethargy, irritability, poor feeding, vomiting or diarrhea, and pale mottled skin. Respiratory infections, signs and symptoms include apnea, tachycardia, grunting, retracting. The greatest risk factor is prematurity. So the greatest risk factor for infection for infants is prematurity. And other risk factors include PROM, chorioamnionitis, maternal fever, and asphyxia, usually at birth. So next we're going to go through the different, the integumentary system, and I think what you have to know as a nurse is most of this is normal, and fathers, parents are just very observant and notice every little spot on their baby. And so when they say, what is this, it's important that you know what it is and, teaching them that most of this is normal and then recognizing abnormal. So the first thing we're going to talk about is vernix. So vernix is produced after 35 weeks. It's a white, cheese-like substance. It's an emollient. It has emollient, antimicrobial, and antioxidant properties. So vernix is a very good thing for the skin, and it's very beneficial to leave residual vernix. Leaving it is beneficial. So it is 2 in the morning, and I'm getting tired, but I'm trying to get this posted for you all. So sorry about that. So it's important as nurses that we don't scrub off all of the vernix, that we leave part of it to naturally absorb. Lanugo is a very fine hair that's over the face, shoulders, and back in preterm infants. So you do not see lanugo in term infants. The simian line is a single crease in the palm of a baby's hand, and it's typical for Down syndrome or babies of Asian descent. Milia are white sebaceous glands on the face. They look like little pimples, and it's important to teach patients not to squeeze them. Don't pick at them. Desquamation is when the skin is peeling in post-term infants. So that's one way to know if a baby is overdue, is their skin peels after a couple days. In this picture, you can see a Mongolian spot. It's a bluish-black pigmentation over the back and buttocks of dark-skinned infants. And most parents that have dark skin have seen these before, but they can be very alarming, especially the location of the back and the buttocks. it can be alarming if people don't know what they're looking for and suspect child abuse. Next is the nevus simplex, and these are also known as stork bites. They are small, flat, pink, easily blanched, and on the head and the neck, and they fade over time. And so these are called stork bites, and these are normal. They tend to get more red when the infant is crying or mad or in pain. Next is the nevus flammeus, or a port wine stain, and this is a pink, flat at birth, and then over time it turns red or purple. It does not blanch or disappear. It actually gets darker as people age, and it's common on the neck or face. So that's a port wine stain. Nevus vascularis, also known as a strawberry hemangioma, is a raised, bright, or dark red. It's got a very rough surface. It's more common in females. It appears on the head generally. It grows for 6 months till the baby's 6 months, up to 2 years, and then it's known to shrink and fade over time. Very rarely they'll need surgery to remove that. But so you can see all of this is normal and usually fade or go away over time, except the port wine stain, and that gets darker. Next is the erythema toxicum, and this is what's known as newborn rash. It appears 24 to 72 hours after birth and can last up to 3 weeks. It's an inflammatory response. It's not of significance and it does not need treatment. It can be located anywhere on the body, and they look like very small vesicles. So it's just considered a newborn rash, and it's an inflammatory response, and it's normal. But it can be pretty significant looking for parents. Signs of problem for the integumentary system. Always monitor the baby's color. The baby's color can tell you a lot of what's going on with the baby. If the baby had a cord around their neck, a nupal cord or face presentation, it would be normal to see bruising and petechiae on the face and even on the eyeballs. You want to assess for forceps marks. And if the baby has petechiae over their entire body, that should be reported. That would be not normal. So petechiae over the entire body would be not normal. Here in this picture in A, we see a stork bite, and again, this is fades over time. And then here in B, we see newborn rash, the erythema toxicum, and you can see the little raised vesicles, and no treatment needed. Just go away. Now we're going to talk about the reproductive system. The female reproductive system, the estrogen in pregnancy can result in a mucoid vaginal discharge or something called pseudo-menstruation. So basically, you can teach parents that when you change the baby's diaper, that they could have a mucus discharge or a small amount of blood or a mini period, and that would be normal, and that's from the estrogens, the high levels of estrogen during pregnancy. In term infants, the labia majora and minora cover the vestibule. In preterm infants, the clitoris or the clitoris is very prominent, and the labia majora is very small and does not cover the labia minora. So you can tell if a baby's preterm just by assessing their genitals. For male infants, the foreskin should completely cover the glands, and the foreskin is not retractable for 3 to 4 years of age. So that's important when you're teaching, that you don't retract newborn foreskin, that it's actually, you can't do it for 3 to 4 years. The urethra should be at the tip of the penis, as opposed to, if it's not, it can be a hypospadias or an epispadias. Testes usually descend around 36 to 40 weeks, and you see an increase in the rugae as the gestational age increases. So a baby that's 40 weeks has more rugae than a male preterm baby. A hydrocele is an accumulation of fluid around the testes, and you can illuminate this with a light, and it normally doesn't require any kind of treatment. The scrotum is more deeply pigmented than the rest of the skin, and so especially in darker skinned babies, that the scrotum has a very dark color, and that's normal. Swelling of the breast tissue is caused by high levels of estrogen in the pregnancy, and it subsides within a few days, and this can be in both female and male infants. They can have a little bit of discharge through the nipples, which is called witch's milk. The breast tissue increases with gestational age, and the size of the areola and nipple also. Signs of reproductive system problems include ambiguous genitalia, and that's when the genitalia, you can't tell necessarily clearly if it's a male or a female. And those babies have to have a follow-up to know, usually CT scans to see, does the baby have ovaries, does the baby have testicles, and then also they usually, of course, do DNA lab work. Hypospadias is when the urethra is on the ventral side of the penis, and epispadias is the urethra is on the dorsal surface of the penis. In either one of these, circumcision is contraindicated, so if the urethra is not located at the tip of the penis, the baby can't be circumcised. And then last, inguinal hernias usually resolve on their own. So you tend to notice them more when the infant is crying, but they usually don't require any intervention.